Welcome to the Mayor's Forum. I'm Mayor Paul Hodson. My guest today is Bill Higbee, Director of Emergency Services for Egg Harbor Township. Bill is here today to talk about the Township Emergency Medical Services Department. Bill, welcome to the Mayor's Forum.
Thank you. It's a pleasure to be here.
Can you tell the audience what your department does for the township?
We are the municipal-based 911 emergency medical service.
And what do you do to manage our department?
Well, I'm the full-time administrator, so I hire the personnel, I staff the ambulances, do the inventory, payroll, and ensure that we are up to all the state's mandated standards.
Okay. What areas does the department cover? I know we covered the entire township, but recently...
Right. We cover Egg Harbor Township, and we recently, starting January 1st of this year, we started covering Summers Point as well. So our area has grown geographically.
Okay. What's the largest area you cover, and how do you do all of that?
Well, we staff 3 ambulances from 7 a.m. to 11 p.m., and then we staff 2 ambulances from 11 p.m. to 7 a.m. to cover both municipalities.
Okay. How many calls typically do you get a day?
It varies from day to day. There are some days where we don't do a lot, but we can do upwards to 20 to 30 calls in a 24-hour period.
Okay. So during the daytime, we have 3 ambulances ready to go?
Yes, correct, at all times.
What typically is a response time for a call?
Well, like in real estate, location, location, location. We are a very large geographical area between Summers Point and Egg Harbor Township, so depending on where the call is and where the ambulances are at the time, our average response time usually goes anywhere from 8 to 12 minutes.
Okay. How many staff makes up your department?
Well, I'm the only full-time employee, and then I have 52 employees that are part-timers that work various hours during the week to cover the ambulance shifts.
Okay. What type of training do you do the staff and receive the work from your department?
All of our employees are certified emergency medical technicians. They are also certified in CPR and AED operations. And
everybody's an EMT?
Yes.
On the rig?
Yes.
And they're mostly part-timers?
Yep.
What type of equipment, and I think you brought some equipment along with you, do you and your staff use in the vehicle or on the scene?
I did bring a little bit that we'll talk about in a few minutes, but we carry a large variety of equipment that can handle medical emergencies, injuries, trauma. We're actually almost a portable emergency room on wheels. It's amazing the equipment that we carry, everything from Band-Aids to long bone immobilizations and also long boards that can immobilize the spine and help us to treat and transport people to get them off to the hospital.
Okay. Bill, you brought some, the abbreviation is PPE, but personal protection equipment. Can you tell us what that equipment's for and how it's used? I
did. Well, as you know, we're in the height of the flu season, so I thought it was appropriate to bring some of our personal protective equipment because cross-contamination is a big problem in our industry. So in this time of year, we carry obviously gloves that we utilize on every single call to protect ourselves and to protect the patient as well. We also carry masks which are going to protect us from airborne illnesses. And not only are we going to protect ourselves, but we want to protect the patient. So depending on the circumstance, we may put this on ourselves or we may put it on the patient because obviously we get sick from time to time and we don't want to get the patient sick from what we're carrying. So we want to protect ourselves and the patient. And we also carry some eye protection because unfortunately we deal with bodily fluids that can be splashed and can be absorbed into our bodies through various openings. So we carry different things that are going to protect us in different ways. And as most of you probably are paying attention to, there's a measles epidemic that's going across the country. And that is something that we don't normally see, but we have to protect ourselves from as well. So there's a lot of things out there that we need to be protecting ourselves and the patients and the general public.
So it's not uncommon to see the rescue squad worker with the mask and gloves on normally to protect themselves and the patients.
Yes. Yeah. Every time you're going to see gloves, but depending on the circumstance and the condition or the type of call that we go on, you may see the mask and you may see the glasses. Yeah. It varies.
Bill, what type of equipment do you and your staff use doing everyday work in the township?
Our department has 6 ambulances, which are state certified and inspected. They carry the same equipment on each one. What we try to do is we try to have each ambulance set up the same way, so that when a person goes on the ambulance, they are looking for, say, a backboard. The backboards are in the same compartment in every single ambulance. It makes it easier and more efficient and a quicker response for the personnel. You're not running around looking at which compartment things are.
Familiarity with your equipment per unit.
Yeah, and all our personnel do rig checks at the beginning of the shift, which is another way that we are able to get the people familiar with the truck and knowing where things are, because speed is everything.
Because most of our ambulances look alike. I mean, you can't
do.
really tell them. They're all well designed and well look alike.
Yeah, they set up. We have the same things in each compartment, and we have everything from Band-Aids. We have immobilization equipment. We have patient movement equipment like stair chairs, and of course the stretcher. And what we've done recently through the generosity of the township is we've been able to start to replace some of our older stretchers with newer hydraulic stretchers.
Okay, that's what I was going to ask you that, because when you got to get the lift and you get everybody on a count of three, you got the hydraulic job, so it's less.
Yeah. Yeah, unfortunately, people are, when people are not feeling well and unable to move themselves, it's difficult for us to move them. So anything we can do to make it easier on our personnel actually saves us injuries and lost time and workman's comp claims. So it's a great thing. It's a hydraulic stretcher. It mechanically lifts the patient up. It can hold a patient up to 750 pounds, which is great for our personnel. And then all we have to do is get them on the stretcher and off the stretcher at the hospital. So there's different types of equipment. We are also now, unfortunately, the way the world is going now, we have had to, because of active shooters, we've had to start equipping our people to handle an active shooter event. We provide ballistic vests. We provide ballistic eyewear for our personnel in case they're put into a situation where they're involved in an active shooter. We also have bleeding control kits now that we have to carry to protect the citizens. We have, we were talking during the break, we carry tourniquets for the person, for the patients, and we also carry tourniquets for ourselves. We are now being trained that unfortunately we have to carry tourniquets in case ourselves or our partner are injured due to gunshots. We have to be able to apply a tourniquet to ourselves, because if we're incapacitated, we're not going to be able to help anybody else. So we carry tourniquets. We carry Quick Clot, which is a blood coagulator, which helps stop bleeding from a gunshot wound or a wound of any type. So not only is it used for active shooters, it can be used for various types of trauma that we experience in the streets.
But I think in my experience, and it's dated, is the tourniquet was the last resort. I mean, you naturally wanted to apply pressure and try to stop the bleeding, but I guess today with the way we deal with active shooters in different cases, the tourniquet's used more often.
Yeah, and it's actually used a lot quicker, because what they're saying now is, when we first learned about tournikets, you didn't put a tourniquet on unless there was no other option.
Absolutely.
That was the only other option, was a tourniquet. Now they're saying to apply the tourniquet because studies have shown that the limb, if you apply a tourniquet, the limb doesn't start to die, it's a bad word to use, but it doesn't start to die until like 6 hours after the tourniquet's applied.
Oh, okay.
So there's plenty of time to get them to a trauma center
and
release the pressure at that point. So tourniquets aren't
That's
the
interesting, because I think they thought the tournament was damaging.
last line of defense.
Right.
Yeah, that was it.
One question I thought about as far as the tourniquet, you want to stop the bleeding, and I guess you guys start IVs right away.
Well, the paramedics go along with us, and they start the IVs to start replacing the fluids as best they can. They manage the airways in order to get them to the trauma center in an expeditious way. It goes back to the golden hour. We all learned about the golden hour. From the time of injury to the time of surgical intervention is supposed to be an hour. That's what they call the golden hour. Yeah.
Really? Okay, Bill, another problem in our community today, and even in the country, is the opioid problem. How's our EMTs prepared to help on this issue?
It's, again, another unfortunate part of the changing industry, that opioids have now become a significant part of our call volume. The overdoses that we see have increased tremendously. So our personnel have had to go and receive training on what to do, how to recognize an opioid overdose, and what to do to counteract it. And not only are we worried about opioids, unfortunately, we're worried about alcohol, we're worried about home medications, people are overdosing on their own home medications or someone else in the home.
Right.
So it's a big problem that we have. The opioids is a problem unto itself, but then we've got the other overdoses that we have to deal with and the mental health issues that are underlying along with it. So it's a crisis that is affecting our country, and it's affecting us as first responders, that we have to deal with the people and also the family members as well.
Right. But Bill, just for somebody that doesn't understand, opioid is basically a prescribed prescription for pain.
Correct. Most opioids are painkillers, and what happens is what the industry has seen is that people are prescribed painkillers for various injuries or chronic pain, things like that. And then when they develop a tolerance to it, they start seeking other ways of relieving the pain and taking care of their issue. And that's when it becomes an addiction. And from there, they start moving into controlled dangerous substances and illegal substances. And they start, using all these opioids that are laced with different things, and that's where the overdoses start to come into play. And unfortunately, we're seeing a tremendous uptick in overdoses.
Right. What is a Narcan? Is it Narcan, right?
Yep, it's Narcan, yes.
Okay.
Narcan is a medication that we carry with us on the BLS level and also on the ALS, Advanced Life Support level. It is a narcotic antagonist. So what it does is, when you administer it, it goes in and it blocks the receptors that the opioid is trying to attach to. So it blocks the opioid from attaching to it and eliminates the high that the person would get from the opioid. Now, unfortunately, it brings the person back up to a conscious and awake, but it's a short-acting medication. So unfortunately, what we're seeing is that, if we don't take the person to the hospital, they have the potential of actually overdosing again when the Narcan wears off.
Okay.
So unfortunately,
So it's still in the system.
It's still in the system.
Narcan, stops it a bit, and if it's a lot of drug in the system, it can reactivate, I guess.
Correct,
is a
yes.
better word.
And I think that's what a lot of people don't realize, is that Narcan itself is a short-acting medication, and there needs to be follow-up treatment with this in case they overdose. And what we're seeing now in the community is you're able to buy Narcan over the counter. So we're seeing people who have people who are in their family who are addicted to drugs. They're actually keeping Narcan in their homes,
Right.
and they're actually giving it to their loved ones ahead of our arrival.
So, and correct me if I'm wrong, this can be purchased in any pharmacy, correct?
I don't know if it's purchased, if it's widespread, but it is available in some pharmacies and some supermarkets. There are places where it can be purchased.
Right.
I would suggest that people do a little research and find out where they can find it, and keep it on hand if they have someone in their life that has an issue.
The other question, and it's just an added question, you're carrying Narcan, and so is our police officers, correct?
Yes.
So it's available if the officer, the EMT, or whatever gets to the scene, they would use it right away or wait, or what would they do if they know it's an overdose?
If they have an idea it's an overdose, they would give it right away. Even if it's not an overdose, if, say, for instance, it's a diabetic issue or something along those lines and presenting with similar signs and symptoms, if they give Narcan, it only works on opioids. So if you give it to someone who's
It wouldn't harm them.
Right, it's not going to harm them. So it's not
Okay.
going to do them damage if you give it to them and it's not the case. It's not an opioid overdose.
Right.
So it's better to err on the side of caution as opposed to not giving it all. And yes, our police officers carry it and we carry it. So whomever gets to the scene first will administer it, and then we'll go in and we'll assist them with their ventilations, because what the opioid does is it slows down the breathing and slows down the heart rate to dangerous levels, so that if there's no treatment administered, the patient will eventually go into respiratory and then cardiac arrest.
Right.
So it's time is of the essence that we get the Narcan on board and start breathing for them to get the Narcan into the system and flowing into their system.
How can we prevent the opioid crisis in the township and even the country? I mean, this is a question that's debated at all levels.
Yeah, it really is. And the best thing that I say as a parent is to be aware of your loved ones. Look for changes in their behavior, look for changes in the things they do, their appearance. It's usually quite evident, people who are addicted to drugs, they do exhibit certain signs, symptoms, and changes in their personality, changes in their appearance. There are counseling groups out there. There are support groups. We carry with us, we work with the police department, and we carry with us a substance abuse resource guide that provides family members with phone numbers to call and support groups and different agencies that are out there to help. And the biggest thing that we try to do is support the family, because everybody focuses on the patient because the patient is the most emergent at the time. But unfortunately, the opioid crisis affects the family. It affects friends, neighbors, relatives, and they need to be assisted and supported as well, because it's a crisis that affects a large majority of our nation.
And probably a parent or a loved one may not understand it as much as an agency like this can help them with understanding the issue, why their loved one is involved in this issue, and how they got started.
Sure.
I mean,
yeah,
it's pretty good.
It's a disease.
Yes.
It's like anything else. It's a disease, and it affects everyone. And unfortunately, we need to treat it as a disease that the person needs long-term treatment, and the family needs to support the person with their treatment and also support themselves with the treatment.
Bill, what type of services does your staff perform out in the field?
Now, we know that we perform. Obviously, we respond to emergencies, which is an important part of what we do. But there's another part of what we do that doesn't always get seen by the community. We have groups that we host at our building. We bring Boy Scout groups, Girl Scout groups in, give them a tour of the building, give them a tour of the ambulance, and put the kids into the ambulance, which is important because, excuse me, because it gives them a comfort level. Because if they ever have to ride in an ambulance, fear is a big factor, especially with children.
The anxiety of being
Yes.
in an ambulance. Okay.
So we put the kids in the ambulance. We let them wear the gloves. We let them go in and out on the stretcher. It gives them a comfort level. Last week we had a group of handicapped people from the ARC Foundation come in and get a tour of the building, and again get a tour of the ambulance. Gives them a comfort level. It's important because most people, when they're put into our realm, it's usually under adverse circumstance. So there's fear involved, there's anxiety, so anything we can do to alleviate that is going to help. Now, we also do community events. We go out and speak to different civic groups. We do standbys. We do BMX is a big thing that we do for the football games. We go to the football games. We're there in case of an injury or anything of that nature. National Night Out. We go, we provide emergency medical services for National Night Out, as well as just getting out into the community.
Right.
With us taking over Summers Point, I think we're going to be actively involved in Bay Fest and some of the community events down in Summers Point as well. So not only do we respond to emergencies, we're also out there in the community trying to make awareness of who we are, what we do, because most people don't see us unless we're in front of their house for an emergency. Right. So it's nice for them to see us in a controlled environment where it's a little more happier event where we can kind of do things.
Just a question, does any of your personnel teach basic first aid or any coursework?
We don't do
CPR
first aid.
or whatever is out there?
The first aid usually comes from one of the larger organizations, the American Red Cross or anything like that. But we do have several that are CPR certified as instructors, and they do CPR recertifications, and they'll also do CPR for groups. If groups are interested in doing CPR and AED training, they can do that as well. So we do have people who do that.
Okay. Bill, if someone wanted to become an EMT and a member of your department, what do they have to do to get qualified?
Well, the first thing they need to do is to take the EMT course. The Emergency Medical Technician course is offered at several places in our area, most notably the Canale Training Center on English Creek Avenue.
Right.
There's a program there. It's approximately 120 hours, goes about a college semester time frame, say from September to December, or say from January to May. In that they get trained in all levels of medical emergencies, traumatic injuries, dealing with the legal aspects of our industry, and they also get some hands-on experience, which is great. They put them in an emergency room setting for 5 to 10 hours where they can be around patients and actually see sick people and deal with sick people, because not everybody is equipped to handle that. It's a different type of atmosphere. There are certain things that people can handle on a regular basis, and there are certain things that people can't. So it's good to get them into that field so they can see if this is for them. You know, the worst thing you want to do is put someone in a stressful situation and have them freeze, because they weren't prepared for handling it. So once they become an EMT, The best thing is to go out and get some experience. There are unfortunately only a couple squads that still do volunteer. We do not. We're a fully paid operation now. The volunteers, it's just become too much for the volunteers to do with the training, with the time necessary, and with people having to work, different jobs. So the best thing is to try to find a volunteer agency, ride as a volunteer, get some experience, and then start applying for different positions, because we're always looking for good hands. We need people. We need reliable people who are willing to go the extra mile, because this is an industry where you really have to want to help people. You can't just come in it and say, it's like any other job. This is a job where you got to have compassion. You've got to be able to do what it takes to help people in adverse situations, and put yourself into some difficult situations as well.
Well, and once you become an EMT, there's instincts. People have different instincts, and familiarization and experience, really counts. Are there additional training needed to keep up your certification?
Yes. Once you become certified as an EMT, we have a 3-year training cycle before you're recertified again. And during that training cycle, there are 3 core classes that you take, one a year, which has different types of components. One is predominantly respiratory, one is predominantly trauma, and the other one is predominantly medical emergencies. And you take them during the course of your 3-year cycle. And you also have to take 24 elective CEUs, which are continuing education units that you take classes over the course of the time. Say, for instance, incident command, hazardous materials, different types of medical emergencies. I just took a class last week on bleeding control, and I'm scheduled to take another class next month on an active shooter. And all of these provide you with CEUs, and once you get your CEUs, then you recertify through the state. Everything is run through the state of New Jersey Office of Emergency Medical Services. Also, during the time period, you need to recertify in CPR. CPR is every 2 years. You recertify in CPR. Most of our personnel are required to take a hazmat class, bloodborne pathogens, and also incident command, so that they can keep their skills up. It's a matter of keeping your skill level up on the different things that you don't see on a normal basis. So we rely on the parents.
Right.
If we're called to your location and you can help us put your child into a child safety seat, please do. Don't be shy. Don't think that we are going to be 100% on point. You use the child safety seat every day. We don't. It's a tool that we need to use, but you may do it a little better than we do.
That's a very interesting point, because my kids are in their 30s, and the car seats that we use compared to today are light years different.
Yeah.
But I guess you're carrying a car seat in that rig.
Yes. All the rigs are
so
required
that's
to have one.
interesting, because the assumption is we're transporting on a gurney, and in this case, a child would have to be put in a car seat, and I would assume strapped to the gurney to transport to the hospispittal.
Yeah, you and I have been in the industry for quite a while.
Wow.
When we first started, what we would do is we would basically sit the parent on the stretcher, put the child on the parent's lap, and strap them both in. Now what we have to do, because of safety, we have to put a child safety seat and strap it to the stretcher, and then place the child and secure the child in the child safety seat, for sure.
When you get a call for, I would assume, a motor vehicle accident, you must stay in control, and how do you do that? I mean, I'm sure things are hectic in a bad accident. If you could just go over a day-to-day motor vehicle call.
Sure.
How do you do it?
Motor vehicle accidents are extremely stressful, because there's so much involved when you arrive on location. The scene is normally chaotic, because not only are you dealing with the patients, depending on where the accident occurs, you're dealing with bystanders, good Samaritans who are there to help out, and you have a person who's now in a damaged vehicle, who is extremely upset and could be potentially have life-threatening injuries. So time is of the essence. We have to coordinate our operations with the fire department, because the fire department may need to be performing extrication with the jaws of life to get the patient out of the vehicle. We need to get into the vehicle to secure them, to protect their spine and their neck. And that puts us in danger now. So now we're putting ourselves into the vehicle. We've got to protect ourselves with our PPE. We talked a little bit about that PPE. That's not going to quite do the job. We need to have turnout coats, helmets, gloves that are a little more than our bloodborne pathogen gloves to protect us, because the jaws of life are going to create sharp edges. They're going to create glass shards that are going to be a hazard to us and to the occupant. And it's a high stress incident. We learn from our experience. That's the best teacher of anything. The more accidents we're on, the better we get, and the more the calmer we get, because calm is important. And I always tell my wife that I kind of get into a zone where I kind of block everything out, and I'm able to calm myself down and just focus on what needs to be done. And then once everything's done, then you can kind of like, take a deep breath and say, oh my gosh, what just happened? And you kind of decompress from there.
Yeah. The question, going to an accident, how are people trained to get through the traffic? And as we know, different periods in the township, our traffic is pretty tight compared to the old days, and I'm sure the old adage is to get there safely. But how do our people, I'm sure they get driver training in the rig on how to get through our traffic and get to the scene?
Yeah, safety is our utmost concern whenever we do anything in our industry. Driving is a hazard unto itself. Now you add in lights and sirens, and the vehicles today are built so soundproof that it's hard for people to hear our sirens.
Right.
And the problem is that we're getting upon people and they don't even know we're behind them. So now they look up in their mirror all of a sudden and we're right up on top of them, and they panic. And a lot of times they'll hit the brakes. What you need to do is move off to the right. In a calm manner, put your turn signal on and move off to the right and allow the emergency vehicle to get by. That's important, because if you jam on your brakes, now what are you doing? You're stopping everything, and you're impeding progress. So move to the right, get to the right. Scan your mirrors. You need to scan your mirrors. If you're playing your music and your windows are up and your fan heat's blowing or your air conditioning heat's blowing, you're not going to hear the siren. So you got to be scanning your mirrors and looking for the ambulance approaching behind you. And not only an ambulance, fire truck, police car, whatever the emergency vehicle may be, they're going to be approaching you at a high rate of speed, and they're going to have a quick closing distance. So you need to react calmly but properly and move off to the right. Now, our personnel do receive training. All our personnel receive defensive driver training. And when we first start people, we have them ride as third. They're the third person in the ambulance. They're basically there for observation only and to get a comfort level under the circumstances and with our ambulances. Once they're a little more comfortable, we'll put them behind the wheel and we'll have them drive back from the hospital under non-emergent circumstances. Because an ambulance is larger than your personal vehicle, so you need to be able to judge, width, length, height, and things of that nature when you're maneuvering through traffic. Some of our intersections are extremely tight and extremely difficult to maneuver through. Once they get comfortable driving under non-emergent circumstances, we'll put them in the driver's seat to transport someone to the hospital in a non-life-threatening manner. Because there are times where it's a non-life-threatening manner, we can go to the hospital in slower means. So then they kind of gradually work their way in. And we also take them to parking lots. We have them drive around parking lots, maneuver through and around cones and things of that nature, just to get them comfortable with, again, the width, the length,
Plus
and the height.
it's a wider vehicle.
It is. It's a bigger vehicle, and a lot of people aren't used to driving. It's the first time
Right.
in a vehicle other than their personal vehicles, and most of our personal vehicles are a lot smaller.
Bill, can you tell us a typical call that would start to finish in the township as one would come into your squad?
Sure. Well, again, going back to the 911 system, you're going to call 911, and what's going to happen is you're going to talk to a communicator. The nice thing about technology is now when you call 911 from your home phone, your address pops up on the screen, so the communicator automatically knows where you're calling from. With cell phones, it's a little bit different. They have to triangulate to get your location. As they're taking information from you, they're going to be dispatching us so we can get onto the street and get responding to your location in a quick manner. We're going to respond with lights and siren in a expeditious manner to get to the scene safely and quickly. Once we get to the scene, we're going to grab a couple pieces of our equipment. We're going to head into your house. Once we get into your house, we're going to make patient contact. We want to make sure that we develop a rapport with the patient and also the family, because depending on the circumstances and the scene that we're coming into, it could be chaotic. It could be distressful. We have a great police department that responds with us on almost all of our EMS calls, so there is a police presence on location to assist us if need be, to maybe control a family member, because again, emotions run high during these events. If someone in your family is potentially dying or having life-threatening illness, you're going to be upset, and we need to make sure if we're focusing on you, we're not focusing on the patient. So once we get in there, we're going to focus on the patient. We're going to do a quick assessment, try to find out what's going on. We're going to ask some questions. What's wrong? When did it start? What's the severity? Then we're going to get into some mundane questions for what you might think, but it's important for us. Your medical history, past medical history, history of what's going on now, medications that you're taking, and also allergies to medications. These are important because once the paramedics get on scene, depending on what's going on with you, they may have to give you some emergency medicines. And if you're taking something that's going to have an adverse effect with the medicine they're giving, it could be dangerous, or if you're allergic to it. So it's important that we get this information. Once we get you stabilized, we're going to load you on our stretcher, get you out to our ambulance. We're going to treat you on the way to the hospital. We're going to be taking your blood pressure, monitoring your heart rate, your breathing, maybe put you on some oxygen, whatever needs to be done, get you to the hospital in an expeditious manner. While we're en route to the hospital, we're going to call the hospital and let them know that we're coming. We have a phone system that's linked to the hospital. We can call the emergency department directly and give them a history. Hi, my name's Bill. I'm coming from Egg Harbor Township with an 8-minute ETA, and I have this, this, and this. That way the emergency room staff is ready when we arrive. We've actually had the emergency room staff meet us as we're pulling into the driveway, depending on the severity of the incident. Once we get you there, we're going to transfer care over to the emergency department. We're going to switch you to their bed, and then we're going to prepare ourselves for the next call.
I think one of the things in this area is the medic units that were available through our hospitals that are close. I mean, in this area we have Shore Memorial, it's close. We have Mainland, it's close. And the ability for them to talk right to the emergency department. Sometimes I've seen the doctors get on the phone with the rescue squad worker or the EMT.
Yes. Yeah, we work very well with Atlantic Care. Where we're located in Egg Harbor Township, we're actually in a great spot when it comes to hospitals. We're directly in between all three. Atlantic Care City Division, Atlantic Care Mainland, and Shore Medical Center. We can go in any direction. Atlantic Care's paramedic units are coming from local areas as well, so they have a quick response time. Sometimes they even beat us to the scene, depending on where they're coming from. And now Atlantic Care actually is putting doctors out there from time to time.
Really?
You may see a doctor, not that often, but every once in a while you may see one of the ED doctors doing a ride along with a paramedic unit. So we may actually have a doctor on scene which can help us as well. So there's a lot of resources out there for us to take care of the general public and help them.
That's pretty interesting, yeah.
Because
I know the cases where a Shore Memorial doctor had gone out in the city of Summers Point for a case. What can the property owner do to make it better accessible for a rig or your squad to get there? And I think that's pretty important. I mean, you guys got to find the location.
This doesn't only apply for EMS. This applies for all first responders, whether it be police, fire, or EMS. I'm an instructor at the Fire Academy, so one of my modules in Firefighter 1 is salvage and overhaul. And what I tell my Firefighter 1 students is you need to be safe when you're operating on scenes. Now, you're going to a place that more than likely you've never been to before. You're going to someone's house. You've probably never been there. Now, we do have people that we go to on a regular basis, but most times we're going to someone's house for the first time. So we don't know where the divots are in their yard or where the tripping hazards are on their front porch or things of that nature.
Or how to turn around in the driveway.
Yeah, or how to get in and out of the driveway, right. So there's certain things you can do as a homeowner and a business owner to make our jobs a little bit easier. So before we have to respond to your scene, place your house or business address numbers on mailboxes or somewhere where we can see them. I can't tell you how hard it is to look and see a little number on a house when you're down the driveway, or especially at nighttime when it's difficult. Keep your property free of clutter and level the grade so we can safely move equipment into the structure and out of the structure. Remember, we're bringing handheld equipment. We have to wheel the stretcher in and out, maybe a wheelchair to get in and out. If it's an uneven grade, it puts us at a hazard, and it also puts the patient at a hazard. Provide lighting on the outside for nighttime responses. It's so difficult for us, number one, to find houses. We drive down a street and every single house is dark. We don't know which one we're going to. So if we're responding to your house, turn the lights on. If you've got a front porch light, if you've got spotlights, turn them on so we can see. Not only does it provide lighting in the yard, it also tells us where we're going to be going to. If we have to respond to you, Have family or friends move any kind of vehicles or obstructions out of the way prior to our arrival if you can. Now, I understand it's a emotionally charged situation, so you may not be thinking clearly, but if you can, it makes our job so much easier. Send someone out to the street to wave us down. It's so much easier if we have a landmark that we can see. For businesses, tell the communicators which entrance that we need to go into. If we're going to, say, for instance, ShopRite, are we going in the front entrance? Are we going in the loading dock entrance? Is it in the meat department, the seafood department? These are landmarks that actually can help us and save time if we're having to respond.
Well, the updates too.
Yeah.
Get to you so you know where you're going.
Yeah. Inside your home or business, clear a path for us to gain access to the patient. It's amazing how much stuff people accumulate in their lives, and I'm guilty of it myself. You know, I have stuff everywhere, knickknacks, things like that. Unfortunately, it provides a hazard for us and limits our access to the patient. We're bringing a stretcher, we're bringing equipment. It's hard for us to move around, and we don't want to damage things in your house as well. You know, if we're swinging a bag or if we're trying to swing the patient, move them in and out, we don't want to cause damage. Going back to nighttime, turn the lights on inside and out. It's important for us to be able to see once we get in your house. We want to be able to see what the patient looks like. Are they pale? Are they diaphoretic? If you turn your lights on, it makes it that much easier for us inside the house. If you live alone, make a key accessible to us in the event that you are unable to get to us. There are so many times where people who are living alone fall, can't get up, they can't get to the front door to unlock it. If that's the case, hide a key in your front yard. Give a key to a neighbor or a family member who can get there and gain access to us. We have people who have lock boxes that are attached to their front door, and there's a code that you punch in, opens the lock box, and their key to their front door is in it. If you do something like this, you can let the communicators know that. When you're calling 911, tell them there's a key underneath the flower pot on the front porch. It makes it that much easier for us. We don't want to have to break into your house. We've had to do that on certain occasions. We don't want to if we can help it. So anything you can do to make it easier for us to gain access to your home is going to be that much better. Another thing that I brought with me, it's something that we initiated a couple years ago. These are called emergency response cards. What these are for is if you are incapacitated and you can't give us patient information, you can attach these to your refrigerator. Some people have them on their cell phones. It's an app on your cell phone you can put on your cell phone, but if we don't have your code to get in your cell phone, it doesn't help us. So what we do is we provide these for the general public. It provides your information, emergency contacts, any kind of illnesses, allergies. On the back, we can put medications with dosages. All these things are helpful for us if you can't communicate with us so that we get the proper information and can give you the proper treatment to make it that much easier and quicker for you.
Very good, Bill. If anyone in the township has questions, where do they get information for the EMS service and where should they go?
We have a direct phone line. We have a non-emergent 911 phone line. It's area code 609-383-0003. Now, bear in mind, we are quite active. We respond to over 5,800 calls a year, so a lot of times we're not at the building. We do have a voice messaging service. Leave us a voicemail. We'll get back to you. Same thing for community events. If you have a community event, you want us to stop by with an ambulance and talk to your children or your community group, leave a message. I'll get back to you as quickly as I can. We're accessible. And also, you can call communications. Communications does take non-emergent calls. You can call there as well and try to get a hold of us in that aspect, and we can get back to you in a timely manner.
Bill, I want to thank you for being here today. This is great information, and I think the township really appreciates all the hard work that our emergency services do on a day-to-day basis. If our viewers have any topics of discussion or a person they would like us to interview in the Mayor's Forum, you can contact the township at 609-926-4044. And thank you for joining us today.